Hello, everybody. Today I am again back with another very interesting topic, uh, rash of less than 3 months old. It's very common to have rashes in the babies and newborns, and most of them are harmless and goes away on their own. And you can see that your baby skin is dry and peeling in first 2 weeks of life, and this is also normal. And usually you can see the common rash seen in past 3 to 4 days of life, which is known as erythema toxicum. And babies with this type of rash are well in themselves. They may have a red blotchy rash that come and go and often appears on face, body, upper arm and thigh. This rash does not require any treatment and will go away on its own. So you just in the first 3 months of life, if your baby have a rash and other symptoms, uh, then you may have to be need to be reviewed by a medical professional. So I will tell you something that you have to look for, you have to be aware of, so that you can escalate as per need of your baby. So first of all, when you will be worrying, that is very serious thing. You think is something serious is happening to my baby. If your baby has pale, mottled, and feels abnormally cold to touch, and has pauses in their breathing that lasting more than 10 seconds, and is grunting and has blue lips, and also stiff, rigid, and makes repeated jerky movement of arms and legs that does not stop when you hold them, that may be feet or scissor, and extremely agitated, that crying inconsolably despite distraction, confused and very lethargic, difficult to awake, has a rash that does not disappear with pressure, I means the glass test, and in under 3 months, temperature of 38 degree or 100.4 degree Fahrenheit or above, unless that is for vaccination and no other serious signs, then you have to call, you go to hospital emergency or phone if you are in the NHS area 999. Now, if those are not there, but still your baby's rash looking small blisters or fluid filled spots, has broken skin, and surrounding area is warm, red, hot to touch, look out for redness around the base of the umbilicus belly button in the first few weeks of life. Nappy rash that isn't getting better with simple measures such as regular nappy changes or barrier crimps, and becoming increasingly sleepy and not consistently awaking for feeds, difficulty in breathing, including breathing fast all the time, widening with their nostrils and pulling the muscles below the ribs while breathing, not interested in feeding, and or looks dehydrated like dry mouth, sunken eyes, no tears, drowsy, no wet nappies in the last 8 hours, or sunken frontinel, soft spot on the head, and whether excessively sleepy or irritable, unable to settle them with anything, especially if they remain drowsy and irritable despite their fever coming down, and anything getting worse and you are worried, it is better to contact GP surgeries or call NHS area 111. And if you see that you have symptom persists for 4 years or more, not able to speak to either your GP or NHS 111, then recheck that whether your child's develop any rare symptoms I already mentioned. Now, if those discussion I did, this red and ambers are not there, it's very common newborn to have blotchy red skin rash 2 to 3 days of age. This is very normal newborn rash and should not bother your baby. It clears in a few days. So Continue providing a child care at home, but if you have concerns, speak to your health visitor or local pharmacist, or you can call NHS area 111. So I hope these are the few things you have to think about the rash. Of course, you have to take your self care because um, you can, treat your baby's minor illness injuries at home. Um, and some illness can be treated in your own home with support and advice from services that I already have mentioned. And of course, um, rest of the best healer of many things, isn't it? Um, so basically, these are the tips about the rashes. I hope this will help you in further time when you can see rashes in the babies. We will come to another topic next week. Bye for today.